Hi students, it's Dr. Cavan, ready for Chapter 2 discussion. So I'm going to pull up the PowerPoint for 2B and we'll use that as our visual. This chapter discusses the special education process pretty much from start to finish. So we'll begin here at the beginning. The very first thing that we do with the special ed process is the identification of students with disabilities. And identification looks different from one student to the next. We always use a multidisciplinary team effort as part of that identification process. Sometimes we begin with screeners, sometimes we use informal assessments, and sometimes we use a really formal process. And it's going to look different from one student to the next. It's also going to look different depending upon the disability that we suspect the student of having. Severe disabilities are usually noted sometimes even before the child is born. We've got a pretty sophisticated system of prenatal screening these days, and many disabilities are noted in utero. And so before a baby is even born, many disabilities have already been diagnosed. Many others are identified right after the birth process or very soon thereafter. And so those disabilities are treated at the time of birth. Some are even treated, there are certain disabilities that are treated in utero. I know that there are a few surgeries that are available for children who have physical disabilities. They can do some surgeries, I think there are some heart surgeries that can be done in utero. I know that there's a surgery for spina bifida that can be done in utero. And so there are several like that when noted in the early stages can be dealt with before the baby is actually even born. Others, chromosomal issues can be noted before babies are born, and then those services that the child needs are dealt with immediately upon arrival in the delivery room. Other things like blindness and deafness, those things are screened for while the baby is still in the hospital, and so those services are begun immediately as well. Students with milder disabilities are usually identified after starting school when teachers determine that they're significantly behind their peers. And so the data gathering begins at that point. Sometimes parents are the ones who are aware that something's going on. Maybe they're comparing their child with older siblings or playmates, and they see that milestones are just not being met when they think that they should be. And sometimes we use what's called a response to intervention system. That's where a child is given a more intensive type of instruction to deal with their lags in achievement in certain areas. If they respond to those interventions, then the notion is that the student does not have a disability. If they continue not to respond, they fail to respond to the intervention, and after repeated trials and more intensity in the interventions, then usually a special education evaluation follows that. We always want to observe the student in a variety of settings. We want to look for particular types of behaviors in a variety of settings. We want to look for behaviors in particular duration. We want to look at the frequency of the behavior or the lack of a skill, its appearance or lack of appearance in particular settings. We want to take anecdotal data, and your book talks quite a bit about this process as well. We also discuss in our textbook the different types of tests, and there are three primary that we look at in this chapter. criterion reference tests, curriculum-based assessments, and norm reference tests. And when you think about an IQ test, that's a norm referenced instrument where we're comparing a person's score with another group of people who are of the same age or grade. And you're comparing that person with other people. With a criterion reference test, you're comparing that person not with other people, but with a certain standard or criterion. You look at that skill, then you're going to measure that person's achievement based upon how they do measured against that skill. A curriculum-based measure is how that student performs in terms of the curricular outcomes of the school or the class. The test that I'll give you in this course is certainly curriculum-based. I've got a set of objectives that we need to meet, and I'll measure your progress toward those objectives. That's curriculum-based measurement. We like to use error analysis when we're looking at curriculum-based measure, sometimes even with criterion-based measures, because it can tell us a lot about what's going on with a student. Sometimes we just think, well, a student has made mistakes. They didn't get anything right on that assignment or on this test. But if we look at the patterns of students' errors, we can discover a lot about their understanding or their lack of understanding of a concept, and it provides and informs our teaching. The book talks about some strategies that we can use to help students work their way toward a solution to a problem, and the think aloud strategy is one of those. Particularly after we do some error analysis, and then we can teach students the appropriate strategy for solving a problem, and then teach them how to walk through that through an oral process. There's a description here of RTI, which I've already kind of given you a little bit of that, but the book talks about that in some detail. It's important to note that there are some exclusionary factors that we have to consider when we're looking at eligibility. We talked in Chapter 1 about how we have the two-pronged test. We have to have not only the presence of a disability, but we also have to have that adverse effect on educational performance in order for a child to be eligible for special education services. We also have to be able to rule out a few things, and one of those is that we can't have a lack of appropriate instruction in reading or math standing in the way of a child's eligibility for special education. So when would that arise? It arises more and more these days with children who are coming out of homeschooling situations, or maybe a private school situation where the receiving school, the public school, may just not know the type of instruction that the child has been getting. Sometimes it's possible that that inadequate education has been given. We also get that sometimes if a student has had chronic absences from any school setting and just has not received constant education in those subject areas. I had a student a few years ago who came to my school district who had been in a refugee camp in a part of Africa before checking into our school. And so there had not been appropriate instruction in reading or math for quite some time. Now, the student was certainly delayed, but we couldn't rule out that it was because of a disability, because of appropriate instruction in reading and math. There may have been a disability, but we couldn't say for sure if it was a disability or if it was a lack of that appropriate instruction. We also have the issue of limited English proficiency, kind of clouding the waters sometimes. And so we've got to make sure that we rule that out as the primary cause. Now, it's possible to have a disability and be limited English proficient, but we've got to make sure that that's not the primary reason that the student is struggling in school. So we've got to be able to pull those issues apart. And it's a very challenging issue sometimes to do that. What you see on the next slide is a list of the 13 disability categories that we have in Texas. A couple of things I want to point out to you. Over on the left-hand side, you see non-categorical early childhood. And this is a category that's unique to Texas. The rest of the country uses a designation called developmental delay, which is for children ages 3 through 9. But in Texas, we don't use the category of developmental delay. We use one called non-categorical early childhood, which is for children who are just 3 through 5. And so if you have a child who comes to Texas from another state where they use the developmental delay label, we can't use that category here. We have a more restrictive, narrow scope for our young children with this particular disability category. And so if a child were to come in with a developmental delay label from another state, and maybe they were 7 years old, well, they've outgrown the non-categorical early childhood category in Texas, and we don't have that developmental delay category. So we'd have to scramble and see if they fit into one of the other categories for special education services, because we wouldn't be able to match that category that they have in another state. The category of intellectual disability is one that has changed a few years ago. About to sneeze. Excuse me. We had a category called mental retardation until 2011. And I think that may be what it says on your PowerPoint still. It's an older edition. But that category changed in 2011 with a law called Rosa's Law that passed to get rid of that somewhat negative language, that perception that we have with the word retarded or retardation that's often used in a derogatory sense. And so we renamed that category intellectual disability. Some people refer to that as cognitive impairment, but the official term is intellectual disability. And those are people who have IQs that are in the 70 or below range. And we'll talk about that in more detail in subsequent weeks. Some of the common evaluation procedures that we have include intelligence testing. That's what we know of as IQ testing. Achievement testing, that's where we look at a student's progress in the academic areas. Developmental assessment, that's where we look at the way a student progresses in kind of the daily living sorts of things. You know, can they get around in the world around them? Can they communicate with other people? Can they cross the street alone? Can they take care of their physical needs and things like that? And then behavioral assessments, you know, how are they getting along socially and emotionally? And then every student that goes through special education gets an individualized education program. We plan for that with that multidisciplinary team that includes a parent, a general education teacher, a special ed teacher, a representative of the local education agency, and that's usually the principal or the assistant principal, and the student when the student is able. And what you see on the next slide are the components of the IEP, and these are mandatory, included for all students in each IEP. The first thing that we always look at are the present levels of performance of the student. How are they currently performing in their school and their classes? Then we look at the goals that we've set for the student. We talk about how we're going to measure those goals and how we're going to talk to parents about that as the student progresses throughout the year. We talk about any support services that the student might need to reach those goals, whether they need some occupational therapy or physical therapy or adapted PE or maybe music therapy or transportation services, all kinds of things that the student might need. We might need to go into the home and help the parents with in-home training or other kinds of things like that. We're going to talk about how the student is going to participate in general education. We're going to talk about how we're going to accommodate for statewide assessments that we do. We're going to talk about when we're going to begin the plan and end the plan. We're going to talk about transitioning the student into adulthood if they're of that appropriate age, and how we're going to transfer them into adulthood if they're that age as well. If the child is young, if they're up to age 3, then we call that an individualized service plan, family service plan, an IFSP, and we develop a different kind of set of goals that you can see here are more general in nature, not academic, but more generalized: physical, cognitive, communicative, social, emotional, and adaptive. We talked in our first chapter about this term called LRE, or least restrictive environment. And that's the last thing that we discuss as we put a plan together for a student, because we want everything else to have been thought about and formulated before we decide where it's going to happen. We want the plan to be in place, and then we decide the location that's appropriate. And we talked yesterday, or in the first video, about the continuum of services, and you've got kind of a list here of where some of those locations might be. And that's the end of chapter 2. So I will post this and then move on to chapter 3.